Hi folks, Dr. Ed Beyer, Beyer Natural Health Solutions. I'm making a video today. We're going to be discussing type 2 diabetes, and I'm going to be talking about the 8 underlying causes of high blood sugar not related to diet and exercise. We all know about diet and exercise, and they are important pieces of the puzzle, but what's never discussed is that there's these 8 other things, and there's actually more, but the 8 real most common ones that we see metabolic issues that is causing your blood sugar to go high besides diet and exercise, stuff that you're never going to hear from your endocrinologist or your medical doctor. So the key point that I really want to make is the medication that you're taking for your type 2 diabetes, it's saving your life, but you have this whole other option available to you called functional medicine, where we look at the true underlying causes, such as the 8 things we're going to be discussing today. So, and also the medication that you're taking does not address these things that are really driving your blood sugar up. They do nothing to actually fix the problem. You can put type 2 diabetes in remission if you identify which of these that you have and remove them. So first of all, I want to talk about what are the consequences of chronically high blood sugar. When we eat and glucose goes up in the blood, insulin is secreted and it puts glucose into the cell. Insulin puts it into the cell. So what happens is if your glucose is too high from diet and exercise, but also the 8 things we're going to talk about today, then insulin goes high. And what happens, insulin's a hormone, and after a certain amount of time, the cells get desensitized to this extra insulin that's there. And insulin is also very inflammatory, so it actually causes a lot of inflammation, a lot of other problems. But when the cell is not listening to insulin, glucose can't get into the cell is going to fatigue. And then a lot of that extra sugar is going to be converted into fat, triglycerides, LDLs, and cholesterol. And that process requires energy. It's called lipogenesis. So if you're getting fatigued after you eat, that should not happen. That's due to this process. The other thing that happens is when sugar elevates in the blood, it's going to attach to a protein or another lipid in the bloodstream, and it forms this complex that's called advanced glycation end products, also known as free radicals or superoxides. These things destroy a lot of things in the blood, the main arteries in the bloodstream get destroyed by these advanced glycosylated end products. They damage blood vessels. Then the blood vessel gets stiff, and then you get heart disease and hypertension and strokes, which is 2 out of 3 of you who have type 2 diabetes will die from one of these. So these advanced glycation end products will go away if you get your blood sugar down. So the other thing that these advanced glycosylated end products, or we call them AGEs, will do is they'll damage peripheral arteries like in your fingers and feet, and it's going to cause fluid retention and bloating and sexual dysfunction because the genitalia is not getting any blood flow. Cold hands, cold feet, hair loss down in the feet, that's a sign we see all the time, and bad skin, flaky, dry ulcerations and all that. The other thing that these glycosylated end products will do is damage nerve endings, especially peripheral nerves, which causes peripheral neuropathy in the feet. It can do it in the hands, but it can also cause neurodegeneration in the brain. If you have type 2 diabetes, you have a 600% increase of getting Alzheimer's and Parkinson's syndrome. So it can cause depression, anxiety, all these neurological consequences because your neurons will be damaged by these end products. Another consequence of these glucose attaching to these proteins is it damages the retina, it damages the kidneys, which is why 20 to 40% of people with type 2 diabetes end up on kidney dialysis. It damages the eyes, it causes glaucoma and cataracts, macular degeneration. So this is another consequence of type 2 diabetes, these glycosylated end products. Folks, hemoglobin A1C is an advanced glycosylated end product. It's like little Brillo pads racing through your bloodstream, just destroying tissue. So that's why that marker is so important. It's a marker, it's a good 90-day marker. It's the best marker to see how you're doing with your blood sugar, but understand that that is super destructive to your body. So you have 2 choices. You can go to traditional medicine and all of its negative consequences and its effectiveness, which I go into more detail in my longer video on my website. Then you have functional medicine, which identifies and fixes the underlying causes. But the key to functional medicine is the proper testing to identify what do you have, what you don't have. So the first of the 8 is thyroid dysfunction. Both underactive and overactive thyroid will increase blood sugar and cause insulin resistance and all the damaging effects. Thyroid hormone is a major metabolic hormone that regulates blood sugar. There are 22 ways your thyroid can go wrong. Traditional medicine looks at one of them. So it's woefully inept. So we do all the testing to really figure out, do you really have a thyroid issue? And we find out the underlying causes and we fix them. The second one is poor liver function. The liver plays a crucial role in regulating the body's blood sugar. Toxins and the buildup of fat in the liver make it harder to control fasting glucose levels. It also makes the body more resistant to insulin, speeding up and worsening type 2 diabetes. The third one is poor adrenal function. There's a hormone called cortisol. When the adrenal glands are stressed, cortisol goes high, and then cortisol will cause the stored form of sugar, of glucose, which is glycogen, to break down. These are the people who go to bed and their blood sugar is in the 90s and they wake up and it's in 150, for example. They're like, how can my blood sugar go up when I'm not eating overnight? It's because there's other things besides diet and exercise that create blood sugar regulation, and cortisol is one of them. So adrenal function has to be addressed to really get to if you have a problem there, to really get to lowering your blood sugar levels. Number 4 is systemic inflammation. When the whole body's inflamed, you will never get your blood sugar under control. Things like food sensitivities to gluten, dairy, soy. We actually do a test to see what foods you're eating that's causing an immune response. Bad oils like vegetable oils and hydrogenated oils will cause inflammation and higher blood sugar. Sugar by itself, hidden infections in the gums or in the gut, or dysbiosis where the gut microbiome, or leaky gut syndrome, autoimmune diseases. All of this leads to elevated inflammation and increased blood sugar. That has nothing to do with diet. The fifth one is an autoimmune disease against the pancreas. This is something called latent autoimmune diabetes in adults, or LADA, or it's sometimes called 1.5 diabetes. These are antibodies against the cells in your pancreas that are causing insulin, that produce insulin. So if your immune system's attacking these insulin-producing cells, you actually produce less insulin and glucose will build up in the blood. So with any autoimmune disease, from a functional medicine perspective, we will sleuth out and identify what is driving your immune system to do that and correct it and put the autoimmune disease in remission. This is very common. These are usually with diabetics that are skinny. Number 6, poor digestive function. There's so much, in our gut we have these things called probiotics. They're bacteria, and they eat prebiotics, which is the fiber in our diet, and they produce these postbiotics, which are called short-chain fatty acids. Those short-chain fatty acids, these postbiotics that are produced by the gut microbiome, the probiotics, the good bacteria in our gut, are absolutely essential to controlling blood sugar. So there's over 138 published scientific articles on the gut microbiome and obesity and diabetes. So we do a DNA stool test to really look at the gut microbiome, and we can restore it through proper nutrition, probiotics or prebiotics, and different antimicrobials if you have an infection. Number 7 is nutritional deficiencies. Nutrients such as alpha-lipoic acid, inositol, chromium, magnesium, CoQ10. By the way, if you're taking a statin drug or a cholesterol-lowering drug, your doctor should have put you on CoQ10, because statin drugs greatly reduce CoQ10, which causes, when it's deficient, high blood sugar. Vanadium is another one. Essential fatty acids like fish oils will lower blood sugar. Vitamin B1, 2, 3, and 5. A lot of you have deficiencies in these nutrients because you're not absorbing them or your diet is poor, but we see lack of absorption. Especially if you're taking, metformin will lower the absorption of a lot of these nutrients, and so will proton pump inhibitors, things like Nexium and Prilosec and omeprazole that you may be taking for acid reflux, which is pretty easy to correct through natural methods. That's a topic for another day. Number 8, medications that raise blood sugar. Corticosteroids, if you're taking prednisone or steroid injections, greatly, just like cortisol, will raise your blood sugar. ADHD medications, antidepressant medications, anti-anxiety medications, birth control pills, high blood pressure meds, especially beta blockers, thiazide diuretics, and get this, cholesterol-lowering medications, statin drugs will elevate your blood sugar. Folks, you got 2 options. Either get to someone who knows how to get to the root causes, or keep taking your medications with all those nasty side effects. And a lot of those medications will only lower your A1C a few points. So an important point is that when you hear from your doctor, well, there's nothing more we can do. remission's not possible. That is from their perspective. What they do is they prescribe medications. The United States represents 5% of the world's population. We consume 72% of the world's pharmaceuticals. From their perspective, there isn't anything more they can do, but you have this whole other world of functional medicine. So they're coming from a pharmaceutical perspective. Like my dad used to always say, if all you have is a hammer, every problem's a nail, but you have this other option. So 6 tests that everyone should get when you have elevated blood sugar. You definitely very comprehensive blood work, a lot more than what traditional medicine does. You really need to look at autoimmunity against the pancreas, an adrenal cortisol test, food sensitivity test, checking for leaky gut, and a DNA stool microbiome test. All this has to be looked at to see if you have any one of these 8 or how many of these 8 underlying causes to high blood sugar that you have. So to recap, the goal with functional medicine is to identify all of the possible glucose metabolism disturbances, remove them, and gradually get you off your medication as soon as possible. The underlying causes to high blood sugar and type 2 diabetes are multifactorial, so much more than just eating too much and not exercising. And they vary from person to person. That's why the testing is crucial. Traditional medicine is a pharmaceutical model and does not look at these underlying causes. I'm Dr. Beyer. I hope you enjoyed this. If you like what you saw and want to see more videos, please remember to subscribe, like, or share this with family members and friends. Have a great day and hope you enjoyed.